My name is Dr. Ben Jauregui. I'm the founding board chair of the Inland Coalition on Aging. I work at Inland Empire Health Plan. I'm the manager for integrated transitional care, and I also serve on the California. I'm a commissioner with the California Commission on Aging. I want to welcome you to our July meeting of the Inland Coalition on Aging. If you're here, it's because you have a why in your life. You have a purpose. You have a passion, or this is part of your job. This is part of your advocacy role. And it was just a second while there we go. And so I'd like to ask that question before we begin really quick. If some of you would like to share verbally, raise your hand. And the question is, what is your why? What is your why? Why do you do what you do? I recently read a book called Start With Why. Um, and Simon Sinek, if you want to look it up, great book about what is your passion? What is your goal in life? Why do you do what you do? And if you stay focused on that, if you focus on your why, if you have a why, your passion will come across and your work will be focused. And it's that North Star, if you will, right? That why that points you in the direction and keeps you focused. And that's what this coalition's about, helping us, bringing us together, and keeping us focused on everything that we're working on, all of our initiatives. So if there's a hand up, sorry, I'm not able to see if there's a hand up, but if you'd like to put it in the chat, please do so in the chat. Tell me, what is your why? Why do you do what you do? And I'll tell you my why. My why is because the playing field is not equal, if you will. Allow me that analogy. The playing field, right, for everybody is not equal. There's bumps, there's cracks, uneven. And if you think of a hockey field, I might have used this example before, not a hockey field, a hockey uh, floor, I guess, if you will. You know, uh, the Zamboni needs to go in there and level the playing field for everybody, right? Level the field, add water where it's missing water, fill in the cracks, maybe even shave down the ice. So that way everybody has the same opportunity to participate in life. I know that not everybody will participate actively in all aspects of life, and that's fine if they make that choice. But I think we should all have at least that level playing field. So that's my why. This is why I do what I do. And my why here with the coalition is, of course, to ensure that older adults, adults with disabilities, and caregivers can age well in the Inland Empire. And so that includes us, all of us, right? We're all aging. And so welcome, welcome. Thank you for sharing those that shared your why in the chat. I don't see hands up, so we'll move on. But thank you for joining us. Continue adding your why. Why do you do what you do in the chat? And inspire us, motivate us. Thank you. I want to highlight really quick, Disability Pride Month is this month, July. Every year in July, we celebrate Disability Pride Month, and that's about celebrating diversity of experience, diversity in life. Disability is just one aspect of diversity, and we celebrate that, acknowledge it, and affirm it here at the coalition. So thank you for all that you're doing to ensure that we are promoting disability pride this month. Next slide, please. All right, so the agenda for today is we're going to give a recap of the last meeting. We like to provide you with a recap because sometimes some themes carry over, and sometimes we have some new folks, so it's nice to connect the last most recent meeting with our efforts, again, being focused, and you will actually see a direct link between the previous meeting to this meeting to the next and next and next. We're very focused, and you'll see that today. Then we're going to have some updates on the MPA, the Master Plan for Aging. Congratulations to all of you. We launched the Master Plan for Aging last month, and it was a phenomenal meeting. I'll go over that in a bit. And then after that, we have a presentation. I'm very excited about today's presentation. We have Disability Voices United today with us, and they're going to be sharing a little bit about their organization. And we're bringing on organizations that are aligned to things that we're doing, and especially interested in hearing any advocacy, social justice efforts that they're doing. because we want to continue what we built with that Inland Empire Master Plan. Right now, it's the time to move those goals forward. Right now is the time for work groups, and we're going to start working on those goals. And so, want to make sure that we know and hear about the great work that Disability Voices is the great work that they're doing, not only in the Inland Empire but across California. So I'm excited to hear that presentation. And then we'll close it by sharing the last, just reminding you of our next meeting next month. So our last meeting was phenomenal. Thank you for joining us, those who joined. And if you couldn't make it, I got to tell you, it's one of my favorite meetings because it was a culmination of 3 years of work. 3 years, for the past 3 years, this coalition has been focused, steadfast, and working on developing an Inland Empire Master Plan for Aging. Similar to Governor Newsom's Master Plan for Aging, we took that model, we duplicated it here. We had 3 years of development of this plan, and that was done through various stakeholder input, focus groups, looking at the data here in the Inland Empire, working with the Office on Aging, Department of Aging in San Bernardino, working with caregiver organizations, working with disability rights organizations, and gathering all that information, especially from rural areas, especially from all communities, including LGBTQ plus community, the Native American data we collected was also instrumental in everything that we did. So 3 years culminated, and then we shared the exciting news that we were launching it. So we launched it last month, and now we're working on these goals. So we'll talk a little bit more about how we need your help with those goals. But as you can see on the screen there, we had a phenomenal guest speakers or videos that were provided previously from some of these speakers. You might recognize a few of these folks. We had Assembly Member Dr. Corey Jackson provide a video congratulating us on our success. And also, some of these videos were acknowledging the fact that AARP accepted or approved and admitted the Riverside County and San Bernardino County into their age-friendly communities network. So because of all the work you've done, all the work that this collaborative has done, coalition, all the work that we've done in working with the Board of Supervisors for Riverside County and San Bernardino County, ARP recognized that and accepted us to be part of the Age-Friendly Communities Network. So very exciting news was shared, and all of these folks here on the slide there sent us their congratulatory messages. We had Senator um, Rosalise Ochoa Bo. We had Senator Eloise Gomez Reyes also provide us with a message. We had in person, we had Susan DeMorris from the California Department of Aging, the director. She was with us in person live. We also had the Honorable Cheryl with us, and she spoke a little bit. And then we also had Carol from the California Commission on Aging. We had Julie Hirsch from local here, Jewish Family Services in the Low Desert. We had Rigo Saborio, who is the director of the Archstone Foundation, a nationwide foundation that supports programs for older adults. And we had the executive director from the Blind Support Services Agency, P. Benavides, also provide a video. If you'd like to watch that, you missed it. Actually, you can click on the link right here on this slide there where it says public launch event. It's on YouTube. You can click that, and we'll share this PowerPoint after the meeting. You can watch the live stream event that is now on YouTube. So next slide, please. Next, our ICA treasurer, Carmen Estrada, is going to tell you a little bit more about where we're at with the master plan for aging. Carmen.
Hi, Ben. Thank you for that. Also, great question at the beginning. I love seeing all the responses, everybody sharing why. We are definitely a very passionate group, a very committed group, and that's, exactly what we need to implement this master plan we've recently created. Some updates. We will be sending out us an annual survey that we're conducting of our membership. We've already sent it out. If you didn't get a chance to fill it out, we will be resending it again. And this is to collect information on our membership to see where we have gaps and where we can make a greater effort at reaching out to other professionals that could join. Also, Speaking about the IENPA, the we will begin our action teams. They will be meeting in September. If you have completed a partner form, you will be contacted in August to participate in the action teams. If you have not completed a partner form, please visit our website and complete a form so that you can join in the implementation. If you don't remember if you completed a partner form, go ahead and email us at info@inlandaging.org and we will find out for you. IEMPA outreach, we're still working on continuing to spread the word about the plan now that it's been completed. Ben presented to the Riverside Commission on Aging on May 19th. We also participated in the RCTC Coordinated Plan Prioritization Workshop on July 9th. And Ben also presented at the Inland Empire Disabilities Collaborative on July 15th. If you are interested in having us do a presentation for a coalition or collaborative that you participate in, feel free again to reach out to us at info@inlandaging.org and we will be happy to do a presentation on the master plan. Next slide, please. Other updates, there's a lot of advocacy still going on, so please look out for communication that we send out. A lot of it is time sensitive and we need responses quickly. So please look out for those emails and please participate in our advocacy efforts. Secondly, please read the Inland Empire Master Plan for Aging. We've completed the document, but it is available for all of us to use. Whether you participate in our implementation groups or not, this is a living document that you can use within your organizations to enhance the services that you provide to older adults, adults with disabilities, and caregivers. So this document that we put together reflects what the needs are in our Inland Empire, and it really should be used by anyone that is providing services to older adults, adults with disabilities, and caregivers. Use it as a guide. Please read it, reference it, and if you want to participate in our implementation groups, please fill out the partner form. And then lastly, please help us continue to spread the word on the master plan and the coalition. We have a lot of marketing tools that you can use in your social media posts by visiting inlandaging.org/media. And don't forget to follow us on LinkedIn. We also post updates on there. If you're connected to LinkedIn, please follow us and we will do the same. It's really important for us to get the word on what we're doing. The more people that know, the more people that can implement the plan together, united, especially during these very, very difficult times. And so that's all that I have for updates. I'll turn it over back to Ben.
Thank you, Carmen. Appreciate that update. Exciting that we're starting the work, just starting the work. I was excited to end the process, but I'm even more excited now to have a goal, to have a plan, and to work towards that collaboratively with the entire coalition here and other partners and other stakeholders. Well, thank you again. I am very excited to introduce Judy Mark, who's going to be speaking to us. She's the president of Disability Voices United. But I want to tell you, I was so moved by learning about Disability Voices United a while back when I heard about Disability Voices United. They were having rallies across the state. The response that I saw from Disability Voices, and it was just remarkable. I was very impressed that I had to get involved. I went out to the rally in Coachella Valley and at the assembly members office and just was very impressed with their work. And I'm glad that we are speaking up even during these challenging times, even more. We should be speaking up during these times. And so I appreciate Judy and your staff, all your work that you're doing. And so we wanted to highlight your work, your advocacy efforts. And so we can take that information, learn from it, and continue the work that's ahead of us. So thank you, Judy, for joining us. I'm going to hand it over to you.
Thank you so much, Ben. Yeah, there's a lot going on right now, and we are so pleased to be able to present to you all today. I'll just introduce myself, and then I'm going to ask my team that when your slides come up, you should introduce yourself before starting to deliver your slides, so we can hold on to as much time as we can for Q&A. So why don't you go ahead and share screen, Vivian? Okay, so first of all, my name is Judy Mark. I'm the president and co-founder of Disability Voices United. We founded Disability Voices United back in 2017, even by a group of very active people with disabilities and family members from across California. We are a statewide organization, so we work a lot in the Inland Empire, but we also work in other parts of the state. I myself am a person with disabilities, as well as I have a son who's 28 years old who has autism and is served by a regional center in the Los Angeles area. What we're going to be talking to you today about is advocacy for and by people with disabilities, more critical than ever. And because as an organization, we always lead with people with disabilities. And you're going to hear a lot of the ways that we work with people with disabilities to increase their participation and their leadership. You can go to the next slide, Vivian. So here's our mission statement, just so that you know. Disability Voices United is a statewide organization directed by and for people with disabilities and our families. We advocate for choice and control over our lives, meaningful outcomes that matter to us, and equity and accountability in the systems that serve us. So just to break that down a little bit, and you're going to hear a lot more in our presentations. Choice and control over our lives is the importance of maintaining autonomy over our lives. So we focus on areas like supported decision-making as an alternative to conservatorship, which you'll hear about in a few minutes. And we focus on the self-determination program, which is an alternative to the way that services are delivered for people with developmental disabilities who receive services through regional centers. Meaningful outcomes that matter to us, we focus a lot on ensuring that the systems that are supporting people with disabilities are focused more on outcomes than on compliance. We know that this is going to be a very challenging thing to make happen, and we've been working on it for many years. We know that certainly in the developmental services system in the state, there is a strong commitment to moving towards an outcomes-based system as opposed to a compliance-based system, but there's still quite a long way to go on that. We work a lot on equity issues. We have produced many reports, and when other folks are speaking, I'll put some of our reports in the chat so you can see. We produced just this year a report called Matter of Race and Place. It was based on a conference we had last year of over 300 people who were people with developmental disabilities and intellectual disabilities, their family members, and professionals in the field, where we worked together to come up with a set of recommendations to improve education, community services, public safety, mental health, preventative health and dental care, and a range of other issues for people with intellectual and developmental disabilities. And I'll put that report in the chat in a few minutes, but it was really focused on equity, particularly for people of color and for people from, depending on their place. So we talked about race, but we also talked about geography, because the Inland Empire is one place that I can tell you, based on statistics, people with intellectual and developmental disabilities are very underserved in the Inland Empire. And then finally, accountability over the systems that serve us. We are primarily an advocacy organization. So while we provide lots and lots of trainings, our trainings all feed into the advocacy work that we do. We've had 8 laws passed since we were founded in 2017, including some pretty huge laws by putting supported decision-making into law for the first time through AB 1663. We also have many different accountability measures that we've enacted. For example, we had a bill signed last year that requires regional centers in the state to be subject to the Public Records Act, which was a huge step forward in improving transparency and accountability over regional centers. All right, you can go to the next slide, Vivian. So I'm going to talk a little bit about the impending cuts to Medicaid, which I'm sure is on all of your minds. So as I'm sure you all know, on this month, because it's still July, just a couple of weeks ago, the U.S. Congress and the Senate and the House of Representatives passed legislation that was signed on July 4th by President Trump, called HR 1 or House Resolution 1. And the bill that was called at one point the big beautiful bill, which obviously was not a great name for it, since all of us think it's a huge awful bill, but it is a massive bill with many different provisions, and it provides huge tax cuts for billionaires. And the way that they achieve at least part of those tax cuts, because it will actually add over $3 trillion to our federal deficit, but the way that they achieve these giant tax cuts for billionaires is by cutting programs for poor people and disabled people and aging people. And so what we know is that it cuts about $1 trillion from Medicaid over the next 10 years. It puts in a work requirement for people who are part of the Medicaid expansion population, which will also include, by the way, people with disabilities, and people who are aging maybe 50 through 64, who may not be able to work for a range of reasons, but also may not be able to establish their disability with the federal government. It's also putting a reapplication. I'm sorry that this is my mistake. It's actually reapplication every 12 months, but there's going to be a very onerous process to reapply for public benefits for Medi-Cal for here in California, for the Medicaid expansion population. And these barriers, the red tape, are going to throw off hundreds of millions of people off of Medicaid. It in particular punishes California on immigration issues. So for states like California that believe in universal health care, it will reduce the federal matching funds that people receive, because that the state of California receives, because we provide funding for, even though it's just state funding for healthcare for immigrants, regardless of their status. It also puts into play a potential trigger for Medicare cuts. While it wasn't specifically in the law, there's a different policy, a different law that specifically says that if our federal deficit gets above a certain level, it will automatically trigger across the board cuts to anything in the federal budget. So it's not just Medicare, it would be defense and other areas as well. But Medicare is such a massive cost within our federal budget, same with Social Security, that these triggers will go into effect unless the Congress does something about it. We don't know whether the Congress will. It's likely they will try to, but even as early as 2026, there could be Medicare cuts. Next slide, please, Vivian. So what will happen in California and in the Inland Empire? At this point, it's unclear. I can tell you that just yesterday, the California Department, the Health and Human Services Agency, CalHHS, put out a video, and I'll put the link in the chat for that video for you as well, because I urge you to watch it. It is very dry and intensely boring. So definitely drink coffee while you're watching it, but it goes through what they think is going to happen. And it includes, so it's the CalHHS Secretary, Kim Johnson, along with Jen Troya from Department of Social Services talking about CalFresh, as well as Michelle Bass from Department of Healthcare Services talking about cuts to Medi-Cal. And I urge you to watch it because it will show you sort of where they're coming from in this area and how devastating the impact is going to be on the state. I actually learned a lot. I mean, they did some calculations of hundreds and hundreds of billions of dollars in cuts because cuts to federal funding in California. And so we are potentially in for a world of hurt starting next year. I do not believe that there will be a special session of the state legislature this year. That has been a conversation that some people are having, that maybe they'll get a head start on some of the cuts. I couldn't predict, but I'm hearing it probably will not happen. And that we'll see the first sign of the cuts in the January budget that Governor Newsom will put out there around January 10th. And that's going to be their first take on how do we plan for the massive federal funding cuts. I also know that the state government is very focused on getting up and running the work requirements for the Medicaid expansion population. I know many of you work with the California state government. It is not what one would call seamless or unbureaucratic. It is, in fact, a massive bureaucracy that puts things in place that make it much harder for people to access services. And so we are going to be very strongly advocating and would love your help with that to make sure that any of the processes that the state of California is putting in place are very easy to navigate and that there aren't any higher hurdles in the bureaucracy that we're going to have to face. The other thing that I should say, just as a disability rights organization, is that we're constantly hearing from the Republicans in Congress that we're going to be fine. Don't worry. If you look at H.R. 1, there's nothing in there that actually hurts people with disabilities. And that is technically true because in Project 2025 and in all the work that the Republicans and all the messaging of the Republicans, they say that they want Medicaid to go to those deserving people. And when they say deserving, they mean people with disabilities and older people, which of course is who you represent and who we represent. But that's actually not reality because it's not like California is going to receive $50 billion less in federal funding and say, okay, poor people, you get nothing. Okay, rural hospitals, you get nothing. Okay, and anybody who has any special needs of any kind besides disabled and older adults, you are going to be you're out of luck. Because that's just not what's going to happen. What California is going to do is they are going to impose across the board cuts. I guarantee it. Every single department, the Department of Aging, the Department of Developmental Services, the Department of Public Health, Mental Health, every single office is going to have to face massive cuts. We're not sure if they're going to give us a chance to weigh in to say how these cuts should happen. They don't always do that. It might come directly from the governor, and this is the way he would want to cut things, and then the legislature may have their own version, but our participation is going to just be on the outside, and we're going to have to be very loud. Which brings me to the third bullet, which is that we are going to argue at DVU that cuts in California don't need to happen if we increase revenue. And what does increased revenue look like? It means tax increases, but we're not going to argue for across the board tax increases. One idea that we are looking at, along with a very broad coalition of trade unions and other groups and healthcare access groups and disability rights groups, is a tax on employers who don't provide health insurance for their employees. It exists in other states. They call it often the Walmart tax because Walmart is notorious for having employees working 29 hours a week so that they're under the threshold of the Affordable Care Act. which requires employers to provide health care for if an employee works for 30 hours or above. And so I think that that's a really important way to go. And I'm hoping that the coalition will be broad and strong and vocal, because it is unlikely that that revenue increase is going to happen in the state legislature. Or because I promise you, Governor Newsom, who's likely running for president, is not going to want to sign a bill that increases taxes. So it's likely going to happen through a proposition, which will be very expensive. And we have got to put the human face on that issue. Next slide, please. Okay, I'm going to hand it over to Brian.
Thanks, Judy. Good morning, everyone. My name is Brian Gutierrez, and I serve as the project manager for the Outreach and Leadership Training at Disability Voices United. I'll be talking about our efforts for improving healthcare for people with disabilities. So DVU recently launched the Communication is Key grant initiative, which I'll talk more. The Communication is Key grant initiative is a project that serves as a model that is designed and led by people with communication disabilities for transforming healthcare to be more accessible, but also inclusive, respectful, and person and patient-centered for people with disabilities. People with disabilities, unfortunately, often encounter healthcare providers who misunderstand their communication needs, making assumptions about their competence, which leads to misdiagnoses, delayed in treatments, but also leads to potentially life-threatening situations. The Communication is Key grant initiative was created to address these barriers by offering training to healthcare professionals based on a curriculum that we are currently developing to support patients with disabilities in a more inclusive and effectively way for improving healthcare. So the model training includes education on supported decision making, which is an alternative to guardianship or conservatorship that honors a person's right to make their own choices with the help of trusted support or someone that you trust, whether it's a family member or a friend. It also includes tools and strategies for improving communication between patients and providers, like such as using plain language on information and materials, providing visual aids, or offering extra time during appointments. It also emphasizes the presumption of competence, which means recognizing that every patient, regardless of their disability or communication style, has the ability to communicate and make decisions in ways that work with them with the right support and accommodations. But it also emphasizes on respecting patients' preferences, who should be present during appointments, or how patients with disabilities prefer to receive their information after an office visit. So to make sure that our project stays relevant and effectively in meeting the needs of people with communication disabilities, we formed a healthcare advisory committee that consists of healthcare professionals in medicine, nursing, social work, and more, who provide guidance on the curriculum, but they also recommend target audiences and also suggest training models or methods for improving healthcare for people with disabilities. So shifting healthcare culture toward empathy, flexibility, also in partnership, ensures that patients with disabilities are heard, but also respected and understood and supported in their healthcare decisions. So with that being said, I'm going to turn it over to my colleague Vivian, who will go over more about supported decision making.
Hi, everyone. My name is Vivian. I'm our project manager for our supported Training and Information Center. And so as a longtime resident of the Inland Empire, I'm so glad to be here and be able to connect with you all. As Brian was mentioning and Judy mentioned as well, our work with supported decision making is largely funded by the State Council on Developmental Disabilities, but we want to talk about supported decision making as it pertains to people with disabilities, the aging community as well. And so, as we mentioned, supported decision making is an alternative to conservatorship. And so, if you haven't heard of a conservatorship, it's created through a court hearing where the judge appoints a conservator who makes decisions for the conservatee. And that results in the loss of rights. And so this can result in the loss of the rights to healthcare, to make healthcare decisions, to make financial decisions. Oftentimes, this is a very permanent decision, and it can be really hard to get out of a conservatorship once you're in it. Um, while in a conservatorship, oftentimes there's a lack of court checkups as well, which is especially concerning when we look at the next point that in the US, half of conservators are strangers. Another large issue with conservatorships is there's no extra protection for our loved ones, and there is no clear succession plan. The conservatorship is in the hands of the court. And so at any point in time, the court can disagree with who is the conservator and appoint someone new or even a professional conservator. And so, as Judy mentioned, DVU's work with passing the law AB 1663 is on supported decision making. And so, what is supported decision making? Well, supported decision making is something everyone does. And it's where we choose supporters to help us make decisions. And this includes our circle of support, right? This can be from our natural circle of support from family members to extended family members to friends to even staff and other professionals as well. And you choose these individuals to help you understand, make, and communicate decisions. And the big thing is, it's designed to change as life changes. Unlike conservatorship, which goes through a court process, supported decision making is flexible. It just requires you as the person wanting support to sit down with who your supporters are and talking about when and where you need support with making decisions. This is also really pertinent when we look at the aging community as well, when we talk about having a plan for the future, sitting down early and talking about who your supporters are going to be when maybe you may lack capacity later on as you begin to age to make decisions independently and getting that support that you need there. And so why? Why supported decision making? One of the big things is decision making is a human right. Like Brian had mentioned, being able to make decisions, it's a right that all of us have. We also talk about dignity of risk, where all of us are allowed some level of risk in our lives, right? And we should allow that same level of risk for our individuals with disabilities and those that are aging as well. And the big thing is it empowers your autonomy. Like Judy mentioned, with our mission, choice and control over our lives is the big proponent here at DVU, and wanting individuals to live a very self-determined life, making sure that you are included in the decisions about your life, right? And making sure that you're able to be a part of those types of life decisions because ultimately that makes life that much more living and that offers so much more protection than it can and allows you to have this circle of support rather than just having one individual be the sole conservator over yourself. And so that's just kind of a snapshot of our work on supported decision making there. And I'll pass it over to Gilda to talk about leadership opportunities.
Hello, everyone. Hi. I hope my audio is coming in good. It was showing as internet connection was slow. But hello, thank you so much for having us and speak with you all today. My name is Gilda Hiron, and I'm the Director of Outreach and Leadership Training here at Disability Voices United. I'm also a parent of 3 kids with different various disabilities. And as we all know, the voices of people with disabilities, along with their family members and caregivers, are essential in shaping the future of aging and disability services. And at DVU, we believe that people with disabilities and their families, caregivers are the experts in their lives, in their own lives. And they understand firsthand how systems impact them and where the gaps are and what needs to change. But despite this lived experience, people with disabilities and caregivers are often left out of the decision-making spaces, especially in healthcare or long-term services, public planning. So true leadership means more than having a seat at the table. It means having the support, skills, and confidence to make your voice heard and to influence decisions in a meaningful way. when people with disabilities and their family members or caregivers are in leadership roles, whether on boards and committees or in um, public spaces, systems become stronger and more equitable. And we know this at DVU. And also services improve, communication becomes more responsive, and entire communities benefit. And that's why Disability Voices United is committed in building leadership from within. And we believe those most impacted by the systems should lead the charge in fixing it. And one of the ways that we've done this at DVU is by creating our program that supports and trains new leaders from across the state of California. We have a lot of people from the Inland Empire join our program, and it's the Emerging Leaders Program. And if you can go to the next slide, Vivian. Thank you. So our Emerging Leaders Program, or ELP, is a statewide leadership program for people with disabilities and their family members, caregivers. We know that many families, caregivers are not only supporting a loved one with a disability, but also navigating the same systems, right? So medical, IHSS, and so many other systems. And that's why we make sure the program is inclusive, supported. It's really grounded in lived experience from both individuals and families and caregivers. And ELP participants, they take part in an interactive 4-part training where they're building skills in advocacy, public speaking. They learn how to practice and how to share their story in 1 minute. They learn about how California and federal government systems work and how to influence change. And since launching, we've trained over 400 emerging leaders from a diverse background all throughout the state of California. And our graduates are now serving on boards, advisory councils, statewide work groups, and speak at public hearings and conferences. The Medicaid work that we did, a lot of our emerging leaders took part in that. And many of our participants are mentored by experienced advocates, both people with disabilities and family members who have been involved in system change for years. So they help mentor our emerging leaders. And our program also has a strong focus on equity, which is the heart of DVU, and we uplift the voices that are often left out. So people of color, augmentative and alternative communication, or people with communication support needs, low-income families, immigrants, and a whole array of marginalized communities. And we intentionally include people with lived experience in our program. And at DVU, we recognize that families and caregivers are a key part, and we don't just want to teach leadership, but we help build it and we help support it. And we would love to collaborate with others in the room who are working to develop leaders from within your communities. So I'd be happy to connect with anyone afterwards who wants to partner or learn more about the work that we do in the state of California and in the Inland Empire. And so, thank you so much. If you can go to the next slide. Judy?
Yeah, so if anybody has any
Hi, how are
questions,
you?
I mean, this here's our
I'm
our social
Hi.
media platforms
quickly
that you
follow up
can
with you.
or whatever. I don't even know social media terms. Our social, our tag, our accounts. There you go. And if you want to just stay involved with us, please join our mailing list, which we can also put in the chat. So we're open to any questions that anybody might have. You can stop sharing, Vivian.
Judy, no worries. I don't have my face either, or any one of those
My,
things.
I'm not a big fan of the social media world, let me tell you.
Any questions for the team? First of all, thank you very much. That was very educational. I learned something that half of all conservators are strangers. That should motivate us. That should prompt us. That should catch our attention right then and there that a stranger is making decisions for me. A stranger is deciding health and finances and everything and wants and yeah, thank you for sharing. This was very helpful, and I'm excited that you've trained over 400 leaders in the community. We need more leaders. We need more leaders. For a second there, Janelle, can you bring up my last slide? Oh, I'm sorry. Any other questions? Any
Connie had
questions
a
before
question.
Oh,
I have,
hi, Connie.
oh, hello, how are you?
Great presentation. Thank you so much. We have a directory, and although the directory is the Black America Resource Directory, it's all inclusive. We don't exclude anyone out of the directory. And we do free listings in our directory for various organizations, businesses that are servicing the community, especially in the Inland Empire. We also have free dedicated space. Our newsletter goes out to about 1,000 viewers in and around the Inland Empire, California, Los Angeles, so on and so forth. So I would like to offer you, if you have an event that's coming up or something that you guys want to promote, in addition to what you're already doing, they'd just like to offer that, that space as well.
Wonderful. We appreciate that. Thank you.
Thank you, Connie. Any other questions? If not, can we please give our guest a round of electronic applause? Thanks again,
Actually,
Judy.
Ben, I have a
Oh,
question real quick.
yes,
This is
Carmen.
Carmen, with the Inland Coalition on Aging and also Inland Caregiver Resource Center. When you are doing your advocacy or events, how do you communicate that with the public, and how can we help at the Inland Coalition on Aging to spread the word or to help you coordinate events in the Inland Empire? When you have either the need for us to make calls or to get together, or to share information, to our contacts. How do you get the word out here in the Inland Empire of the different activities that you're doing?
Thank you so much for that question. So we use various ways. We have a very large email list. Of course, it's a statewide California list. Actually, it's a national list because people join us for our events from all over the country at times. But we email people. We have weekly reminders, we have daily reminders, we have monthly newsletters, and so we do a lot of emails. We are also really active, not me, but others, on social media. Our community tends to use Facebook more, and so we are advertising all of our events not only on our Facebook page, but we know the Facebook pages that other people are using to get their information. And we also are on Instagram and on X. We would love assistance in doing outreach for some of our events. We are actually worked very actively in the Inland Empire. So not only did we had two of our Week of Action, Disability Week of Action events in the Inland Empire in front of congresspersons' offices in both Hesperia and in Palm Desert. But we also we work very closely with the Inland Regional Center and have had we did a conference last year on the self-determination program and just had a major resource fair there in June. And I believe we'll probably be doing another major conference for them next year. We often, when we partner with other groups, we also encourage them to get the word out about our various activities. We also, by the way, we run a support group for the Inland Regional Center on a monthly basis. So if you join our mailing list, you will see all the events that we promote. you know, for us, you know, advocacy is the really critical thing. So right now, the advocacy events that we're planning are somewhat around the Americans with Disabilities Act anniversary, which, as you know, is on Saturday. We're having a big press conference tomorrow with actors with disabilities and actors who have children with disabilities. And on Saturday, I know you guys are in the IE, but if you are willing to schlep far, the U.S. House Ways and Means Committee, which is the committee that passed H.R. 1, is having a hearing at the Reagan Library in Simi Valley. So I know it's a schlep, but this is your chance to be in front of the members of Congress who actually passed a law that is going to severely hurt the aging and disability communities. So we're trying to organize a group of folks to attend that hearing to certainly, I don't think they're going to let us do public comment, but we will make our issues well known when we're there, and potentially I'm now trying to work on seeing if we can even have a small press conference outside of the library or down the street or something along those lines. So you know, please continue to join our mailing list, and if you are able to help us with our advocacy, it is really, really helpful.
Thank you.
Thank you, Carmen. Elizabeth.
Hi, Judy. I may have missed it, but I was curious. I helped coordinate the needs assessment for the Master Plan for Aging, and it came up a lot that individuals were really concerned about conservatorship as they aged, especially in the LGBTQIA committee, where they may not have as many social supports through family. And so I was curious if your organization either does community presentations to educate people about the supported decision making, or provides resources specifically that like senior centers or community groups can use for these presentations.
I'm going to let Vivian answer that.
All right, I tried to press mute and then all these tabs like started showing up there. But thank you for the question, Elizabeth. We actually are having, I'm putting it in the chat right now. We are doing a supported decision-making summer series that actually begins tonight. It'll be a 4-part series. Tonight we'll provide an introduction to supported decision-making. We'll have self-advocates there. And the other parts, we're going to talk about finance, healthcare settings, in voting, as well as in education, which is may not be as pertinent for the aging community, but for all those other sessions, we're going to have professionals as well as self-advocates there sharing resources and tools that they can use with supported decision making. I think a lot of times, especially for things such as healthcare and finances, people are worried about if I don't have this natural circle of support, who is going to make these decisions for me? And so we talk about different tools that you can implement in using supported decision making there. So I have posted the link to join that as well. We do have a
Oops, did she drop off? I know that she's in an area that has very poor cell signal. So, well, I'll try to finish what she was talking about. So, we have a whole set of materials, some of which we've developed already. She might have put it in, let me scroll up there. She might have put it in the chat. Oh, there, you're back, Vivian. Okay, go ahead, you continue.
So sorry about that. My internet completely dropped off. But yes, I posted the registration link to our summer series. It begins this week, or tonight, actually. I'm also going to put in the chat the link to our parent handbook, and it's a very in-depth guide to supported decision making there, as well as link attachments to different forms, as well as a resource library at the end for other resources as well to use supported decision making.
So I'm just going to add, Elizabeth, and the rest of you, is that there's very little data on who is actually conserved or how many conservatorships there are in the state of California. There's no requirement that courts provide that information. So we don't know, but we have done a lot of trainings for what's called a court investigator. These are the folks who go out and visit annually conservatees and conservators. And what they tell us is about 80% of their caseload are people with intellectual and developmental disabilities who are conserved with the support of their regional centers. So that has been a very prime target of ours. The other 20% are other kinds of folks, including older adults. So that is an area that we have not spent as much time on and really want to. So if any of you are interested in us doing a more comprehensive training for aging organizations on supported decision making, that is something we would love to do. It doesn't have to be just the Inland Empire. It could be aging groups from around the state, and we can do it virtually to make it easy for people. So if there's somebody out there who would want to organize that, we would love to deliver that training for free for everybody.
How long would a training would you need for a training like that?
I mean, we can do any kind of length, hour and a half. Somebody's asking if they can copy and paste from the chat.
Judy, I was wondering, are you the person to whom someone would reach out to set that up?
No, it would be Vivian.
Okay.
Vivian, if you could put your contact information. Oh, you did already. That's Vivian@dvunited.org.
Thank you.
Yes, and the training would be free. I see Celine just asked that question.
And Connie's asking if we participate in health fairs. We really haven't, but we are open. I mean, if people ask us to participate in things, we are really open to participate in most events that exist out in the community. We have a whole outreach department that goes to these kinds of fairs.
All right. Well, given the time, I think we're gonna thank again, Judy. Thank you so much and your team for this awesome presentation. We are going to connect, and I'm sure a lot of coalition members would want to connect with you also. So thank you so much.
Thank you.
Janelle, can you bring up the last slide, please? It is so timely, this quote that I found, given the presentation that we just heard from Judy. Oh, by the way, our next meeting is Tuesday, August 26th. See you there. We've got another presenter lined up, so please join us. Next slide. This quote right here, I love, by Dr. Martin Luther King. He said, "Our lives begin to end the day we become silent about things that matter." I hope we don't stop talking. I hope we don't stop sharing. I hope we don't stop advocating for our communities. Thank you so much for this timely message, Judy, again. Thank you all to the coalition members for joining us today. We will continue our work. We will continue advocating. We will continue working on our goals to ensure the Inland Empire is a place where we can all age well. Oh, almost forgot. Very exciting. If you're available this Saturday, the Civil Rights Institute in Riverside is having an ADA celebration also. It's from 11 to 2. I put it in the chat. Please join us there. They're going to have speakers, networking, various organizations there. So hope to see you there. I will be there. I will be one of the speakers. So again, thank you so much for all that you do and for helping us to ensure that everyone in the Inland Empire can age well. Take care.